ultrasounds in KIAMBU County. No any other county has received machine. Now, Your Excellency, sir, allow me to show you some of the features of this machine. This is a machine that is of high advanced machine of its kind. It's going to do all the procedures, including checking your kidneys, checking the obstetric ultrasound for the mothers, also checking the utero, fetus who are still in the uterine cavity inside the womb. We are able to pick any anomalies and be able to treat those fetus before they are unborn. Also, for the boy child, you've not forgotten them with this machine. For this probe and this one, we are going to evaluate the prostate so that we can pick the prostate cancers early, and also the testicular cancers that tend to occur in male patients. Thank you so much, Your Excellency. As you can see, this machine has to, it's a digital one, it's a touch screen. It's not analog as it used to be. It's going to make the work of the sonographers and radiologists very easy to scan. That means the turnaround time for the patients is going to increase. Initially, we could scan like 40 patients in a day. But this particular machine, we are going to scan over 100 patients in a day. And we are going to improve the services in all the facilities. It has both the normal, what we call the normal ultrasounds, where you can scan the abdomen, the small parts, but it also has an advanced features for the echocardiogram. We are able to evaluate your heart. In that we can see the ventricles. If there is, we can see all the ventricles, the actual what we call the heart chambers, and also we can pick a thrombus. We have pulmonary embolisms, and those most of the time we didn't have them. Patients tend to collapse because of the lack of fast services. During the echo, I can pick that clot, and the patient receives the treatment, and instead of death, the patients will be alive. Yes. So we have the computer part, which are now too. I can even be able to have a conversation with my patient. I'm able to scan. I will use this computer down for me to be able to scan and change what we call knobology, these settings to get a good image. And this one, I turn it to the patient. So the patient is also able to view what I'm scanning. Yes. And get the first-hand information just when we are scanning. Unlike before, the patient could not be able to interact with me during scanning. I simply finish the scanning, give the report, without even the patient having a glimpse of seeing it. Like expectant mothers, they also love to see how the babies are moving, and also they want to see the sex of the baby. That we call the gender. I'm able to scan, and they will be able to see for themselves. Yeah.
Wow, tupigie huyo madam makofi vizuri.